On July 18, 2006, a patient bled out on the operating table. The surgeon's hands were shaking. He couldn't stop the hemorrhaging. 3 nurses watched in horror as the patient died. That surgeon had performed over 3,000 surgeries in the past 20 years. He had 0 medical training. Not 1 day of medical school. No degree. No license. Nothing. His name was Gerald Barnes. And for 2 decades, he cut into living human bodies while hospitals paid him hundreds of thousands of dollars. Nobody checked his credentials. Nobody questioned his methods. Nobody stopped him. Until that day in July when everything came crashing down. But here's what makes this story truly terrifying. Gerald wasn't the only one. The system that allowed him to operate for 20 years is still broken today. And what investigators discovered about how he pulled this off will make you question every doctor you've ever trusted. This is the story they don't want you to know. Gerald Barnes started his medical career in 1986. He was 34 years old. He had dropped out of community college twice. His only healthcare experience was working as a hospital janitor for 6 months. That's it. But Gerald was smart. Dangerously smart. He knew the system had a fatal flaw. Hospitals in the 1980s rarely verified credentials thoroughly. They trusted paper documents. They trusted confident men in white coats. Gerald created an entire fake identity. He forged a medical degree from a university in the Caribbean. He invented a residency program that never existed. He fabricated reference letters from doctors who weren't real. The documents looked perfect. Official seals. Embossed stamps. Professional letterhead. He applied to a small hospital in rural Montana. They were desperate for surgeons. The nearest major hospital was 200 miles away. They hired him immediately. His starting salary was $80,000 per year. Gerald Barnes walked into an operating room and performed his first surgery. A routine appendectomy. The patient survived. So did the next one. And the next. Gerald learned surgery by doing surgery. On real people. With real consequences. He spent nights reading medical textbooks. He watched surgery videos. He practiced techniques on cadavers he illegally obtained. For 5 years, he operated in Montana. Then he moved to a bigger hospital in Nevada. Then California. Then Texas. Each time, hospitals accepted his credentials without verification. Each time, his salary increased. By 2000, he was making $40,000 annually. But Gerald's luck was running out. His complication rates were climbing. In 2003, a patient named Sarah Martinez came in for gallbladder surgery. Standard procedure. Low risk. Gerald operated. He severed her bile duct. Then he panicked and cut a major artery trying to fix it. Sarah needed 3 emergency follow-up surgeries by real doctors. She survived but suffered permanent liver damage. She sued the hospital for malpractice. The hospital settled for $0.2 million. They never reported Gerald to any medical board. They just quietly let him resign. He moved to another state. Another hospital hired him within 6 weeks. This pattern repeated 4 times between 2003 and 2006. Patient injury. Settlement. Resignation. New job. The medical community has a dirty secret. Hospitals don't share information about problem doctors. They're terrified of lawsuits. So they pay settlements and stay silent. Gerald exploited this perfectly. But the complications kept getting worse. In 2005, He botched a routine hernia repair so badly the patient lost function of their leg permanently. In early 2006, a woman died from sepsis after he left a surgical sponge inside her abdomen. The hospital paid her family $50,000. Still no investigation. Then came July 18, 2006. A 52-year-old man named David Chen needed cardiac surgery. High risk, but David trusted his surgeon. Gerald had performed this surgery successfully before. Or so everyone thought. Midway through the operation, Gerald made a catastrophic error. He punctured the heart wall. Blood flooded the chest cavity. He had no idea how to fix it. The nurses called for another surgeon. But it was too late. David Chen died on the table. His wife was waiting in the lobby. She had no idea the man operating on her husband had never been to medical school. The hospital couldn't hide this one. The death triggered a mandatory state investigation. That's when everything unraveled. Investigators requested Gerald's credentials for verification. He disappeared the next day. State investigators started pulling the thread. They contacted the Caribbean Medical School on his resume. It didn't exist. The residency program he listed? Fake. The reference doctors? All invented. They traced his work history backward. 20 years. 14 different hospitals. 8 different states. Over 3,000 documented surgeries. Not one hospital had properly verified his credentials. Not one. The investigators found 127 malpractice settlements connected to his surgeries. Total payout, $4.7 million. But here's the part that will make your blood run cold. Gerald Barnes was actually a decent surgeon by the end. His complication rates in the final years were only slightly above average. He had taught himself surgery through trial and error on thousands of unwitting patients. Some of the doctors who reviewed his later cases said his technique was competent. He had essentially completed a 20-year residency program using real patients as practice. The victims had no idea. Most never knew they'd been operated on by a fake doctor. The hospitals never told them. Even after the truth came out, many hospitals refused to contact former patients. They claimed it would expose them to lawsuits. A class action lawsuit eventually forced disclosure. Over 2,800 former patients were notified by mail. The psychological trauma was devastating. People who thought they'd had successful surgeries suddenly questioned everything. Had their complications been